So today I'm going to be performing subcutaneous injections. The first thing I'm going to start with is my critical elements. So to begin my critical elements, I want to verify my orders and gather my supplies. So the orders I have today are 10 units of NPO insulin and 7 units of regular insulin. And then for my other order, I have 6,000 units of heparin, and that is going to be calculated to 0.6 milliliters. Heparin is only given it's ordered in units, but we dispense it in milliliters. So I verified my orders. I'm going to perform hand hygiene. I'm going to identify my patient. Hi, my name is Danielle. I'm going to be your nurse today. May I have your name and date of birth? Okay, beautiful. And I'm just going to check her wristband while I'm here. Okay, and then after I did that, I'm going to be telling her what I'm doing today. Okay, Mrs. Jones, today I'm going to be giving you a subcutaneous injection of insulin, and I'm also going to be giving you heparin for your, which is a blood thinner. Okay, and the insulin's going to be used to manage your glucose levels. Do you have any questions for me about the medication that you're taking and, what is going on? No? You have no questions? Okay, beautiful. And then now I'm just going to prepare my environment, provide some privacy, and I'm going to document if needed. And then now I'm going to be saying my 5 rights of medication administration. So again, the time. So the time is going to be before lunch for the insulin. We're going to be doing the insulin first. So the time is going to be before lunch. The route is going to be subcutaneous. The amount is going to be 7 units of regular insulin, 10 units of NPO insulin. And then the medication is obviously insulin. And then I'm going to be saying the patient is Jessica Jones and she has no known drug allergies. And then I would, again, go to my patient and say, do you have any allergies? She's going to say no. Okay, no known drug allergies. Okay, that's beautiful. Okay, so now I'm going to be looking at my medications that I have, and I'm going to be comparing it to the EMR. Okay, all right, so these medications match up with the EMR. Okay, and while I'm here, I'm going to be looking at the expiration date of these medications that I have here, and their valid expiration date, and the vials are intact. There's nothing wrong with them. So once I've done that, I'm going to now scan my patient's barcode, and then I'm going to be scanning the vials, okay? And if a discrepancy exists, I'm going to check the chart and make sure and verify the orders for the patient. And now I'm going to be, I already checked my expiration date. Now I'm going to be calculating the correct drug dosage. So for the insulin, we're going to be doing it where we're taking it only in one syringe. So I'm going to have a total of 17 units in my syringe, 10 being the NPO and 7 being the regular insulin. And it's important to not get the NPO insulin to contaminate the regular insulin. Okay, so we have to use a specific technique when we are drawing up these medications to avoid that. Okay, regular can go into NPO, but if NPH goes into regular, it's going to change the half-life of the regular insulin. So we want to be specifically careful with the way we do that. So that is that. So now I'm going to just go over the different insulin syringes that we can use. So we can use a 0.5 milliliter syringe to a 3 milliliter syringe for insulin. It has to be an insulin syringe for insulin. Insulin you can only inject with only insulin syringes. And then you could either have a 3/8 inch needle or a 5/8 inch needle. So from 3/8 to 5/8 is the length. And then the needle gauge can be 25 to 30. So we want this to be really small. Okay, and the reason why we mix it into two and one syringe, because we want to limit the amount of times the patient's going to be getting poked. So if they're getting this and the heparin, you don't want to be poking them 3 times. And you also want to, you know, change the where you're injecting it. So that's another thing to look out for. You don't want, you know, the goal of this is just to not inject the patient too many times. You know, it's uncomfortable for the patient to be getting injected every single minute. So, you know, that's okay. So now I'm going to be alright, so now I'm going to be preparing my medication. So what I'm first going to do is I'm going to take my MPH vial, and I'm just going to be rolling it because you don't want any sediment to be stuck at the end. You want the concentration of the medication to be even. So I'm just going to be rolling it. Okay, and then once that's rolled, I'm going to get my alcohol swabs. And I'm just going to cleanse the top of the vials. Okay? Alright. And this would be for 15 to 30 seconds, and we want it to dry completely. So that's going to dry. I just want to double check. Okay, so I said that we were doing 10 units of NPO. So now I'm going to want to take my syringe. It's already, the needle is already on, so I don't need to do anything to that. I'm going to take my needle, uncap my needle, and I'm going to draw up 10 units of air. Okay, and I'm holding it at eye level to make sure that is. Alright, so it's at 10 units. I'm going to be holding the vial and injecting that 10 units into the vial. Okay, and now I'm going to take it out. I'm going to draw up 7 units of air. Thing is giving me a hard time. Okay. And I'm going to inject the 7 units into the vial. And now I'm going to be drawing up 7 units of regular insulin. Oh, I forgot to inject it. Inject the air. Draw up the 7 units. 7. Alright, and then I want to just make sure I'm expelling any air bubbles. So I definitely want to secure that needle while I'm going to be doing that. And it went right up. Alright. Perfect. And take it out of the regular. I'm going to put it in the MPH. And then draw up to 17 units. And you don't want, when you're drawing up the NPH, you don't want to, you want to get the exact amount the first time, because if not, you're going to need to get a new vial after. You're going to ruin it. Alright, so I got my 17 units. Okay, I'm going to take it. I'm going to recap it using the one-handed scoop technique. Alright, So now I have my prepared syringe. Now I'm ready to administer it to my patient. So then again, when I go to my patient again, I'm going to be doing my critical elements again. So, hi, I verified my order. So the order again, I'm verifying my order. So my order again is going to be 10 units of NPO insulin, 7 units of regular insulin, and it's being injected in the same syringe. And this is going to be before lunchtime. And then I'm going to be verifying my order, gathering my supplies. I have my syringe ready. And then I'm going to be I'm going to perform hand hygiene. I'm going to introduce myself to the patient. Hi, my name is Danielle, and I'm going to be your nurse today. Can I have your name and date of birth? Okay, beautiful. That's great. And I'm just going to check your ID for spin, make sure everything matches up. All right, great. Okay. And then now I'm going to be asking the patient. I'm going to be giving you a subcutaneous injection for your insulin this afternoon. It's going to be 10 units of NPO insulin and 7 units of regular insulin. Do you have any questions for me today? And I'm also going to be giving you your heparin. And your heparin is for a blood clot. Is that okay with you? All right. You have any questions? No? Okay, that's fine. So now once I did that, I just want to prepare the privacy, and then I'm going to document if needed. And then again, I'm going to want to say my 5 rights of medication administration. So my 5 rights is the time. The time is going to be before lunch for this medication. The route is subcutaneous. And then the amount is going to be 17 units, 10 units being NPO, 7 units being regular. The medication is insulin, and the patient is Jessica Jones. The patient's Jessica Jones. And then once I did that, I'm going to want to take my medications again, and I'm just going to be looking at the EMR, and I'm going to be comparing my medications to the EMR. And while I'm doing that, I'm going to be looking at the expiration date and making sure that the expiration date is valid. So that's what that is. And then once I did that, now I'm going to scan the patient's wristband, and then I'm going to scan the medication. And if a discrepancy exists, then I want to recheck the charts and look at that medication order to make sure everything is right. And now I'm going to be performing hand hygiene. After I did all that, I'm going to be performing hand hygiene. Okay? Hand hygiene. And I'm going to be putting on gloves for this. Alright, so here I am. Putting on a clean, non-sterile gloves. Alright. Okay, and now at this time I'm going to be going over what is it? I'm going to be going over the injection sites for a subcutaneous injection. So first you have the abdomen. You can do subcutaneous in the abdomen. You want to do 1 to 2 inches from the umbilicus. And then you also have the posterior and lateral upper arm. Posterior and lateral upper arm. And then you have the anterior lateral upper leg. And then you have the upper ventricle gluteal area, which is here. Upper ventricle gluteal area. And then you have the scapula area at the back that you could be doing this in. And then you also want to be, in any injection, you want to be avoiding scars, bruises, any lesions. You want to avoid any of that. 1 to 2 inches away from anything on the skin. And for this injection, we're going to be doing it at 90 degrees. Heparin is typically done, we're going to be doing it at 45 degrees for the purposes of the testing. So now I'm going to be cleansing my patient. I'm going to be cleansing the patient's skin from inner to outer for 15 to 30 seconds. Okay, and I'm going to let that dry completely before I do anything. while that's drying, I'm just going to prepare my needle. I'm just going to take the medication out of it just so that I don't inject this into the injection pen. Alrighty. And we said the total amount is going to be 17 units. Alright. So now that's completely dry. I'm going to want to uncap my needle. Okay. And I'm going to be holding the subcutaneous tissue, and I'm going to be holding this in a dart-like motion, and I am just going to inject. I'm going to release the skin, and then I'm going to inject, stabilizing the needle. You don't want to move, you don't want to aspirate. Okay, and you want to take out the needle the same way you put it in. Okay, and you want to apply gentle pressure to the needle, and you're going to want to recap that needle. Okay? Alright, so that's done. Usually you would do the needle guard, but I'm going to be reusing this for practicing purposes. So I wouldn't, but if I was to be testing off, I would activate that. So now the patient has got that injection, and I'm going to perform hand hygiene, get rid of my gloves, you know, and then now I'm still with the patient, and now I'm going to be doing my heparin injection. So again, for my heparin injection, I'm going to want to say my my tramp. I'm going to want to, you know, verify my orders and say my tramp. So for the heparin injection, it's going to be the time. The time is now. The route is subcutaneous injection. The amount is 6,000 units of heparin, which would be 0.6 milliliters. And then the medication's heparin. And the patient is Jessica Jones, and she has no known drug allergies. Okay, so now I'm taking the vial, and I'm just going to be comparing it to the EMR and making sure that everything matches up. Okay, so this matches that. All right, that's perfect. And now I'm going to scan the patient's ID wristband, and I'm going to scan the medication. And that worked out good. No discrepancies there. And then I'm just going to be looking at the expiration date to make sure that it's still good and it's still valid for use, and it is. And if it was a multi-dose vial, I would want to label it with my initials, the date, and the time, just so that whoever opens it, whoever uses it next, knows when it should be expired. So that is that. So I went through my tramp, I went through it same as before, and then I'm going to prepare my site. So again, I'm going to perform hand hygiene. I'm going to put on my gloves. Putting on my gloves. And again, the sites for heparin are the same for insulin. It's the abdomen, the posterior and lateral upper arm, anterior, lateral, upper leg, the ventral gluteal area, and also the scapular areas of the back. Okay, so now I'm going to be taking my, another alcohol pad, which should already be here, and I'm going to be preparing my patient. Well, I'm not going to be preparing my patient just yet. I have to prepare the vial. So I'm just going to take my gloves off for now. Alright, so now I'm going to prepare my vial. I'm going to clean my vial off. Okay, and again, I said it was 0.6 milliliters. Alright, so I'm going to draw up 0.6 milliliters of air. Alright, so now I have my 0.6 milliliters of air. I would inject the air, invert the vial, and draw up the medication. But for the purposes of right now, I'm just going to leave the air in it just to save some time for myself. And now I have that prepared. okay? Again, I already went through all that stuff for my patient. Again, I would compare the medication, again, to the EMR. I would compare it to the EMR, and then I would, go through my time, route, amount, medication, and patient. I would go through my tramp. I would compare this to the EMR, and then I would scan my patient, scan the medication again, and make sure. And then at the end of the procedure, I'm going to double check before I discard anything that it was the right amount. So now I'm preparing my patient, inner to outer, for 20 to 30 seconds. Okay, you want to let that dry completely. I'm going to be putting my gloves on and then doing that, actually. So putting my gloves on, I perform hand hygiene, and I am going to prepare my patient site. Okay, let that air dry. And I'm going to be doing this at a 45-degree angle, and the patient has no known drug allergies. And the preferred site for heparin is the abdomen. And with these injections, you want to be rotating, where you're injecting in the abdomen. Okay, so now that's dry, I'm going to uncap my needle. I'm going to hold the patient, and I'm going to be doing it at a 45-degree angle. So this would be 90. I'm going to be doing it at 40 degrees. So I'm going to grasp it, and I want the bevel to be up. So I'm just going to go. Release the skin, inject the medication. Same way it came in, 1 scoop method. All right. And we wouldn't be recapping the needle, but for the purposes of practicing, I'm going to be keeping it. So I would discard this in the sharpest container. And I would also be applying pressure to the patient, light pressure. Okay. So now the patient has gotten all of their injections. And now I will be asking the patient, do you need anything else from me? I'm going to perform a hand hygiene. Do you need anything from me? Here's the call bell. I'm going to be back in 15 minutes to see how that medication's working and what is affecting you, okay? And that is all. Alrighty. Thank you.